Assalamu alaikum wa rahmatullahi wa barakatuh. Coming to you live from Cape Town, and we are at the Islamic Medical Association Convention Center. And the doctors and the professors have all gathered here to share latest insight into the industry and what is the latest research and so forth. Today, joining us is Professor Musa Mohammed Nordin, all the way from Malaysia, and he will be chatting to us for a short while. Professor, thank you very much. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam wa rahmatullahi ta'ala wa barakatuh.
Professor, it's an honor having you on our platform, mashallah.
Yes. Alhamdulillah, I'm very pleased to be back again in South Africa. South Africa is like my second home. I've been here in Joburg in 2013 when the conference was organized, and then 10 years later in Cape Town, and now I'm here again with the brothers and sisters from IMASA, the Islamic Medical Association of South Africa. Alhamdulillah.
Alhamdulillah. Professor, talk to us. What are the key issues at the moment at hand, and what are some of the key projects that you are working on?
I am presently the chairman of the FEMA Advisory Council, whereby we have about 9 senior doctors or veterans of the Federation of Islamic Medical Association who in this council advises the executive committee and the FEMA council with regards to the higher issues that is being faced by the Muslim healthcare professionals in the world. So we advise on what issues that are pertinent that should be taken up by the FEMA Exco and the council. I'm also the editor-in-chief of the FEMA yearbook, so whereby we discuss various healthcare issues from an Islamic perspective. For example, the issue of IVF, in vitro fertilization, the issue of advanced medical directives, the issue of birth control. All of this, we look at it from the perspective of a Muslim healthcare practitioner professional. And I'm also the advisor to the group of brothers who are responsible for safe and clean water, what we call FEMA Safe Water. So we try and make sure that vulnerable, marginalized, dispossessed communities like the Palestinians have access to safe and clean water. So at this point in time, we have built in Palestine 32 water desalination plants, because 95% of the water in Palestine, in Gaza specifically and West Bank, is non-drinkable. It is not safe. So the 35 water desalination plants are meant to purify and to desalinate the water from underground and make it safe for the Palestinians to drink. Because at this point in time, many of these water desalination plants have been bombed and targeted by the Israeli occupying forces. So my 20 guys in Palestine are trying to salvage this desalination plant so that we can still have access to the water, purify and desalinate them, and put them into trucks so that they go to Khan Yunis, to Jabalia, to central Gaza, to make it accessible to the displaced Palestinian communities. Because this is vital, because it is one of the necessities in life, isn't it? Apart from food, water, shelter, and healthcare for our children and our women and our men in Palestine. So the teams that we have in Gaza make sure that the displaced communities have access to safe and clean water.
What a noble initiative indeed. Jazakallah khairan, and it's a pleasure chatting to you.
Thank you very much, and I'm looking forward to the conference with our brothers and sisters in the Islamic Medical Association South Africa and the community of healthcare professionals from around the Muslim world are also here to enjoy the conference, inshallah. Thank you.